Anna is a GenerationQ Fellow and Director of Quality Development at Northumbria NHS Trust. Anna was an absolutely core part of the group of us that have put the bid together, being coordinated really. I feel like Anna was the lightning conductor that brought us all together. So Anna, are you ready to offer your presentation?
Absolutely. Let me try and share my screen and get right back to the beginning. Lovely. I've never been compared to a lightning conductor before, but I kind of quite like that. Thank you, Benna, and thank you, Kate. Isn't Kate inspiring? Oh, every time I hear her speak, I learn a little bit more. So thank you, Kate. I thought it would be helpful, really, just to kind of think about why this stuff is important. And, you know, Lou kicked us off today by saying that when she had kind of been thinking about the quality improvement training that she was running in Gloucestershire, she realised that there was a real gap around Deming's kind of human behaviour or psychology. And we've heard from Kate that that's the case too. And I guess that's how I got interested in this. I realised that we were treating training and the writing up of quality improvement programmes in a really kind of technical way. And we were forgetting to write about or think about or note the relational aspects of improvement, which I think the more and more that you do improvement, as I'm sure we've all done in the group today, you realise that actually that's at the core of improvement. And so for me, I think whilst Deming had a really strong sense that all four of these lenses of profound knowledge were equally important, I think that when we've come to teach people about quality improvement, especially in the UK, we really have paid attention to the other three lenses and not the one on human behaviour. Now, in the UK as well, I think that when we do think about how does human behaviour fit in with complex adaptive systems, we tend to then start to think about the work really around patient safety and around human factors. And whilst this is incredibly important and is part, I think, of the psychology of improvement, I think when we think really only around how the system can design itself around our humanness, we miss out on a whole range of important thinking around what we can do in a very active way as well to influence our environment. So I think there's room to add to human factors in our work, and I'm really hoping that some of our conversations kind of tease out some of these kind of the way in which some of these things come together. And certainly, if you believe what Marjorie Godfrey has been saying for many, many years from Dartmouth Institute, 20% of improvement is technical. So the evidence, the measures, the tools and the methods. And 80% tends to be psychological or relational or adaptive. So things like individual and team or group dynamics, culture and leadership, behaviour and habits, the power and quality of relationships and trust are really, really important. And for me, when you ask what matters to people, if you ask those questions in really human ways, like why will you put yourself through change? Why would you act? Why would you care? Why does this matter to you? You start to understand that the key really to a lot of improvement is intrinsic motivation. Now, the other person that's hugely influenced my thinking is the work of Professor Michael West, who works from the King's Fund and has done an awful lot of study with his colleagues around the impact of culture and of leadership on patient safety. And if you look at Michael's work, he helps us to think that this stuff is not just kind of pink and fluffy or the soft stuff. He's really brilliant at bringing out what impact of working in a what he calls a real team, where you feel that you've got psychological safety and you feel that you're listened to, that you can have agency for improvement and you can feel safe. When he looks at the difference between working in a team like that or working in a team where you really aren't feeling part of it, he says that actually that can really have a massive impact on mortality. And whilst the studies have really only included acute trusts at the moment, when you look at what happens in an average sized acute trust, even a 5% increase of people feeling that they're working in these real teams can save on average around 40 deaths per year per hospital. So for me, it really brings home the power of getting this right or the power of getting this wrong. And so I think my motivation for getting interested in this work has been really to think about how could we as improvers start to help to think about how we create these cultures of compassionate kind of ways of improving together, so that we can actually help to create not just a better environment for patients, but also how we get better at thinking about staff kind of well-being. So Kate's already talked quite a bit about the psychology of change. I think one of the things that would be really interesting to explore in this group as well is how do we start to help everyone understand about the neuroscience of change and how the brain has been kind of evolved and has wired up in order to respond to change. We know that every improvement that we do requires some kind of change. And so I think we could really help each other as a community and create a greater body of science and evidence really about how, if we understood the way that the brain works, we could get better at helping to make kind of change not necessarily more manageable, but more understandable for people. We also know that trust is really important in improvement. And this is a slide that shows the unpublished work of a renal physician called Dr. Partha Das, who was a Darcy Fellow, actually he was a Harkness Fellow, and he went out to the States and he did a study of 500 physicians. And he asked them, why would you get involved, or what would motivate you to get involved in improvement? And he was really shocked when he analysed his results to find that at the bottom line of it, it was trust that would get people involved. Either trust that the purpose of improvement was worthwhile and related to people's personal values, or trust that the approach had some chance of success, trust that the right people and credible people were on the team. Won't surprise you to see that trust in the data was really important for people. And also a sense of trust that the improvement wouldn't make life worse. So I think all of these kind of show us really that these relational aspects of improvement are really important, just even to get people to consider being involved. And I think my hope for this group is that we bring together some of these kind of ideas. We help to debate them amongst ourselves, and that we really kind of embrace some thought diversity about what we could achieve together, challenge each other, be rigorous around looking for the evidence. Equally, be a voice for where no evidence yet exists, and how do we get on and create it for ourselves, so that we can bring the kind of the lens of psychology much more into focus for the community, and hopefully kind of give back some resources and some considered debate. And also, I think it'd be really great to experiment with using some of these techniques amongst ourselves as a group, so that we kind of live and breathe what we believe in as well. So I certainly hope that we'll have that philosophy of all learn, all teach, and that we'll really work together strongly over the next year to really come together to create something very special for the community. So those were my early kind of thoughts. I truly believe we're going to be stronger together through this, and I'm really excited to think about what I will learn from all of you as well. So thank you, everybody.
Thank you, Anna.
Let me just stop sharing. There we go.
Thank you. It's fantastic, inspiring, and I think really underlines why it is that all involved in this, you know, why it matters so much. So thank you. That feels like a really helpful follow on from Kate's contribution.